He's experiencing all of these pains and all of these problems associated with his low back, but the disc is not the offending issue. So again, this was by just dumb luck. They had a scout where they had this one view of the particular entirety of the body, with the exception of at the very, very top. But where's the problem? Here. And here we go. Hello everyone, I'm Dr. Jeffrey Hanna. I'm a board-certified upper cervical chiropractor, and welcome to The Big Idea, the show where we're talking about the health of your neck and trying to give key takeaways to help people who are experiencing problems with the head, so headaches, neck pain, but also balance disorders. And today I'm going to be talking about and sharing a very interesting case on what's known as a degenerative cervical myelopathy. In brief, what this is this is where something is producing friction against the spinal cord in the neck. Not to the point that anything has severed or there's paralysis or anything like that, but there are transmission errors in this electrical conduit right here that can start to show up in very weird but also very interesting ways. I personally believe that, especially in our older population, that this is a far more common occurrence than is actually diagnosed. And so what I'm going to be doing is show you a little bit just to illustrate what we're talking about here. Number two, look at some research that lets you know these are what the key symptoms to be looking at that should making you think, uh-oh, there's something that's wrong in this area of my body. And then number three, sharing this particular case on what's actually a pretty profound resolution of symptoms. So let's jump into it. Okay, first up, one of my favorite videos that I enjoy sharing, a video that's illustrating what actually happens with our brain and our spinal cord. That unlike static MRIs, which are really good for diagnosing problems, the reality of what's going on beneath the surface is that our brain, but more importantly our spinal cord, actually oscillates like this, up and down approximately 1 centimeter with every beat of the heart and with every breath that we take. And you might be able to see it down through here. So our spinal cord is this black thing that you see right here. And you will notice all of this white stuff all the way around it. So that is the cerebral spinal fluid. It goes all the way down to our tailbone, and that essentially cushions but also provides the energy, the electrolytes, the oxygen, so that the brain and the spinal cord can work right in the first place. And ideally, the spinal cord, as it's going down through our body, should be sitting in the middle of our spinal canal, where if you're looking on it from the side, for example, you would see white space in the front, you would also see white space in the back. The problem then is if we ever have a physical injury, disc damage or something like that, that starts to essentially intrude on that functional space. In the beginning, I'll use a disc because that's the most common issue that we're dealing with in the neck. If the disc starts to bump up against the connective tissues right through here, then you can actually see that indentation on an MRI. If it becomes pronounced enough, then that bright white fluid starts to go a little bit fuzzy gray, and it's kind of like turbulence in water versus something that's flowing cleanly. And if it becomes pronounced enough, then what it does is it starts indenting not just the connective tissue, but it can actually start indenting on the spinal cord itself. That, of course, is not going to be a good thing, and it's going to lead to a certain variety of symptoms in our body. Question is what symptoms are those? So I've got this research study for you guys, the pattern and chronology of symptom development in degenerative cervical myelopathy, a clinical study. The reason that I share this is if I was to say to you like, whoa, I'm getting this really weird squeezing pain in my chest, and I'm having trouble breathing, and it's kind of radiating up the side of my neck and down into my arm. You know, it's like, okay, this is a concerning sign that a person is having a heart attack. And we know we need to take immediate medical action. But something like a degenerative cervical myelopathy, you've probably never heard of that thing in the first place unless you've recently been diagnosed and you're trying to get some information. But the question is, what are some of the early symptoms that can warn us that, hey, we may have this problem going on the inside? And ideally, if we do not want to have emergency surgery, what are the things that we need to be aware of so that we can be preventing something rather than waiting for crisis and then hopefully cure on the other side of that? So these guys here, they looked at 138 patients diagnosed with this particular condition, and they asked them, what are the most common symptoms that you guys are experiencing? Some of these, I don't think you will have any surprise. So top of the list, neck pain. Number 2 on the list, back pain, low back pain. The reason for that is because remember that we said the spinal cord is a transmission line. So the outside of the cord is actually what is transmitting the information from the low back up to the brain. And that's the area that is most likely and directly in the firing line. So can you have low back pain coming from somewhere else? You absolutely can. I'll hit on that in just a few minutes here. Next up, upper extremity numbness, tingling into my hands or my fingers. It's not always carpal tunnel. It can sometimes be tingling in the hands because it's a downstream effect from something that's actually coming from up in the neck. Gait imbalance. So this means unsteadiness. So messages about where your body is in open space, brain's not processing that, and as a result, we start to feel a little bit off balance. And also upper extremity incoordination. So we notice that we're starting to drop things. Now, I do also want to add in this because there's a certain point where, people tolerate a lot of symptoms, but there's a certain one that you never want to muck around with. So again, like the heart attack, the squeezing pain right here. How do you know that you need medical intervention? I mean, right away, like this is not a chiropractic, this is not a PT kind of thing at this point. You got to rule out the most dangerous, scary stuff. That is if you have a loss of bowel or bladder function. That's where the nerve is no longer, the spinal cord is not just being irritated, something's starting to die here, and you need emergency medical attention to find out what that something is. Now, when they started to put all of this stuff together, though, here's where it starts to get interesting and when you have more of the take-home message here. So they're finding here, so most symptoms occurred frequently. So 6 days a week. A person, all of us, we're going to get little aches and pains, things like that. But if you're experiencing persistent or recurring issues that are happening pretty much every single day, that's a sign something is really not right. And we should not just put up with it and hope for the best. That is our body warning us that, hey, we got to do something about this. Otherwise, it's going to get worse. And also, common co-occurrences were neck and back pain, neck and upper extremity numbness, and neck pain and gait imbalance. Do you see a pattern right here? So oftentimes, and we see this very frequently, oftentimes a person experiences low back pain or sciatica or tingling into their hands, and they're seeing a specialist or they're trying to work on the back, but then they also have neck pain. If you're experiencing neck pain plus other symptoms in your body, odds are there's a common origin. And because of how we are built neurologically, it means that, hey, we actually need to look upstream. We need to look here. So if you're dealing with back and neck issues, the problem may not necessarily be coming direct from the back in the first place. Now, what I've got for you here was a case who we were recently taking care of in our practice. This is a gentleman. He's been under our care for a long period of time, history of neck issues, history of headaches. He'd also had surgery to stabilize basically damaged discs in his low back. And he's been doing really good for a long time. But then pretty much out of the blue, he experiences what's called cauda equina syndrome. So, yes, his neck hurts, but he's got bad sciatica. He's starting to develop a foot drop. That is not a good sign because it means the muscles are not getting the juice to actually work the right way. And sure enough, he's getting abnormal function of bowel and bladder. Again, these are the red flags. One of the first things that we did was we said, okay, you have got to get a series of MRIs. We got to find out if the nerve or something is like compressing it, and that's where it's dying. Do you need to go see the neurosurgeon right out of the gates? It took them a little bit of time, even though we had said you need to go to the hospital for this. It's one of the unpleasant things here in the US is that if a person needs an emergency MRI, sometimes the insurance companies get in the way of that. Fortunately, he did not have a progression of symptoms. He was relatively stable, but things were not getting any better whatsoever. So what we did was we were taking care of him, trying to manage things conservatively, doing a little bit to help release tension in the low back. Of course, we're checking the upper part of his neck. And when he comes to our office on one of these days after having the MRI, here's what he shows us. So what we've got are his MRIs. So this is going to be the low back. If you're wondering, that guy looks really weird. Remember I said he'd had previous surgery? So this is his low back. And then this was by dumb luck, they did a scout view for the rest of his spine. So what you might notice over here, if we're looking at the level, so here's your sacrum, L5, 4, 3, I didn't count right, 5, 4, 3, 2, and then 1. You will notice that these discs, so these black things right here, they're starting to protrude into the spinal canal right through here. But at the same time, the spinal nerve roots and the cord, as they're coming down right through here, they're not sitting anywhere near those points of protrusion. In other words, he's experiencing all of these pains and all of these problems associated with his low back, but the disc is not the offending issue. And when we were looking and reviewing his MRI, do you guys see where the issue actually is? So again, this was by just dumb luck. They had a scout where they had this one view of the particular entirety of the body with the exception of at the very, very top. But where's the problem? Here. So zoomed in. This one here, you'll notice the white stuff that should be around the spinal cord. It's dirty gray. Fluid's not flowing right through there. And these gray things right here, these are going to be each of the bones. And then these dark things are going to be the discs. Have a look. Level of C5. It's indenting on the connective tissue around the spinal cord, and it's obstructing that space where that fluid needs to flow. And even more pronounced, C3, indenting on the cord right through here, obstructing flow. Now, what we ultimately decided to do, because again, the surgeons had already seen him, they were looking at his low back, and they said, nope, we don't see anything that we should be doing surgery. These symptoms should go away on its own. No, he's experiencing dangerous kind of symptoms. We got to have a look and we got to figure something out. So I was doing an assessment for him and recognized, or just on the exam and then looking at this, like, you've got an issue at C3. We've never actually adjusted your C3. Let's give it a go. Again, this is not the kind of chiropractic adjustment where you're trying to force things into place, because the truth is, an adjustment does not push a bone back into place at all. It's more release tension that's restricting things in the connective tissue and then allowing the muscles to do the work on their own. So I made the choice, with his permission, it's like, okay, let's go ahead and do an adjustment for C3. Had him rest up for a few minutes and then rechecked him. He said even just him resting for a few minutes, he could feel kind of things waking up in his foot. You know, like if you're falling asleep on your leg and it starts to have that wake up kind of feeling. Later that day, he gives our office a ring and said he can actually move his foot again. Week or two later, he's back in the practice just for a usual checkup, and he says pretty much all of his symptoms are resolved. Now, does that mean that a magic adjustment is going to fix these things in 100% of people? No, that would not be true. But in his particular case, it turned out that the nasty symptoms he was experiencing down in the lower part of his body were actually coming from not the top of his neck, but closer to in the middle. And this is why it's important, number one, to recognize what some of the dangerous, scary kind of symptoms are, but also recognize that especially if we're having issues here with other places in the body, we can't just focus on the one spot. We need to know, number one, okay, what are the symptoms, certainly, but far more important, not the diagnosis, what is creating and causing the diagnosis in the first place. So fortunately, good ending from this particular case here. And thank you guys, as always, for watching. If you did find this video informative, useful, hopefully not too boring, please click that like and that like button, and then share if you've got friends, family members you think could benefit from this. And if you are a registered healthcare professional, please click that subscribe button so that I can share this type of information. Hopefully makes every single one of us better. And if you'd like more information about the particular work we do in our practice, you can visit us at clearchirospokane.com, where we share videos, blog posts just like this about the different conditions for the people that we commonly see, and we would be happy to help in any way that we can. Thank you guys again for watching. This is Dr. Jeffrey Hanna at Clear Chiropractic, Spokane, Washington.